Sometimes getting a good night's rest isn't as easy as shutting your eyes. If you are one of the 30% of Americans who have problems falling asleep and the day's worries threaten the night's sleep you want, you need something that works. For more than 2 decades, people have turned to Ambien. Talk to your provider today about getting a restful sleep for tomorrow with Ambien. The first stage is called non-rapid eye movement, also known as NREM Stage 1. It occurs when people just start to fall asleep and only lasts 1 to 5 minutes. The body is beginning to relax while brain activity slows. Some people may twitch. Someone is easily roused from this stage. In the next stage, NREM 2, their muscles relax more. Their temperature drops while their heart rate and breathing slows down. It lasts 10 to 25 minutes, and the person is more resistant to being woken up. The next stage is NREM 3. Heart rate and breathing continue to slow down, and the muscles relax more. This stage is where the body recovers and grows. Brain activity shows delta waves. It lasts from 20 to 40 minutes. Lastly is the rapid eye movement, or REM stage. Brain activity looks like the person is awake. The muscles are paralyzed except for breathing and the eyes. The eyes can be seen moving around while being shut. During REM, dreams occur. It is thought to be important for creativity, memory, and learning. It lasts 90 minutes. Zolpidem helps people fall asleep faster. It has been shown to increase the dormancy of the REM stage within clinical doses. Zolpidem was shown to improve sleep efficacy and lengthen sleep duration. Therefore, sleep onset is hastened, and the duration is longer, but has more latent REM. Indications for use are treatments of insomnia, takes effect in less than an hour, and improves quality of sleep and affects total wake time and decreases the number of nighttime awakenings. It is FDA approved for short-term treatment of insomnia, middle of the night awakenings with difficult returning to sleep with greater than 4 hours of bedtime remaining. The primary target symptoms are total sleep time, nighttime awakenings, and time to sleep onset. Side effects include sedation, dizziness, ataxia, dose-dependent amnesia, hyperexcitability, nervousness, hallucinations, diarrhea, nausea, and headache. Life-threatening side effects are respiratory depression, angioedema. Do not take with other central nervous system depressants. The advantages are that it can be used in patients who require long-term treatment. The disadvantages is this medication is more expensive than other sedative medications. Now, what are Ambien's contraindications, warnings, and patient teaching? As all other drugs, Ambien is contraindicated among individuals who have a known hypersensitivity to it, such as anaphylaxis and angioedema. It is advisable that before initiating Ambien, all other causes of sleep issues should be assessed, such as medical or mental health histories. Taking Ambien with other medications that are metabolized through the CYP450 is also contraindicated. Chlorpromazine and imipurine, for example, when combined with Ambien, can cause alterations in alertness and psychomotor performance. Usually taking a lower dose of Ambien is advised. As for warnings and precautions, the assessment for other comorbidities is crucial because failure to remit between 7 to 10 days with Ambien may mean that there is a hidden psychiatric and/or medical problem that needs to be addressed. Severe anaphylactic and anaphylactoid reactions, such as angioedema on the tongue, glottis, or larynx, although uncommon, can occur and can be lethal. Thus, if there is a history of angioedema caused by Ambien, it is best not to re-challenge the medication. Next, some atypical judgment and behavioral changes may happen. Ambien is a sedative hypnotic and may cause diminished inhibition like exhibiting aggression, extroversion, or behaviors that are out of character, much like when somebody is intoxicated or is taking some CNS depressant. Other symptoms include auditory and visual hallucinations and engaging in complex and risky behaviors. Any rapid dose decrease or sudden discontinuation of Ambien may cause withdrawal-like effects. Lastly, since Ambien is a sedative hypnotic, it can cause CNS depressant effects. The main part of medication education about sedative hypnotics is to instill knowledge about its effects to the body that could potentially harm the patient, in particular drowsiness. Any decrease in mental alertness can place a patient at risk of accidents on the road if the patient decides to drive, or being harmed while operating machineries, or even falling. Advised to avoid mixing Ambien with alcohol or narcotics for the risk of severe central nervous depression. The possibility of failure to recall past events might happen. Forgetting activities and conducts such as eating, driving, or engaging in intimacy after going to bed have been conveyed by some people who took Ambien. If engaging in risky behaviors and forgetting about it is suspected, patients should immediately inform their doctor.